Hello and welcome to another edition of Health Matters on Channels Television. It's great to have you join us. I am Mary Alala Yusuf. On the average, 15 million babies are born prematurely. That's just over 1 in 10 babies. And the World Health Organization says the numbers are rising. Preterm birth is the leading cause of death in children under 5 years of age. Of 100 extremely preterm babies, more than 90 die in the first week of life in developing countries, and less than 10 in the developed world. What is being done to reduce the numbers of babies born too soon? On the show with me today is Dr. Emmanuel Uwe. He's an obstetrician and gynecologist and a fellow at the Lagos University Teaching Hospital in Diaraba. You're welcome to the show.
Thank you very much.
Let's start with what makes a baby premature. When is he born? At what time do they call him premature?
Thank you very much. However, for the layman, they use the word premature always. But for the obstetrician, we use the word preterm.
Preterm.
Because premature, it gives the impression that a child has a problem, it's premature.
Okay.
However, preterm is when the baby is born from 28-week gestation to 36 weeks. Once it's less than 37 weeks, it's considered preterm. So that is the term we use. We people, sometimes we consider premature when it's less than 34 weeks because the lungs are not matured enough to really survive or do well after birth. So that is preterm birth. Now,
there was this other term. There's preterm, premature, but then there's extremely preterm. What's the difference?
Okay, that one as well. You see, in the developed world, they use their age of viability as 24 weeks. But we over here, we use 28 weeks. So for them, because the definition really comes from them, it's from that 24 to 28 weeks, they call that very extreme because the chances of survival is also reduced. However, from 28 weeks to 34 weeks, it's the term, will I say, premature, or the middle aspect of the preterm birth. Then from 34 weeks to 36 weeks is the early one.
Okay. Now, in developing countries, out of 100 extremely premature babies, 90 die. That's in the developing world. There are only 10 left alive. How many of the 10 might be Nigerians? I know that's a very cerebral question, but the statistics say that Nigeria is among the 5 leading countries when it comes to numbers of premature babies.
Yes. For my story also, it's total, the number. Because of our population, we tend to have a lot.
Yes, but then, we are just behind China and India, which are the most populous countries.
Exactly. But however, when it was estimated per 100,000 live birth, Nigeria was not in the first 10 in Africa.
Okay, great.
So because they did it in ratio to live birth, not just total.
To the population.
But when you look at the population as a whole, Nigeria is actually ranked 3rd in the world.
So would you say we're not doing too badly on that?
Well, it's difficult to really say because in as much as we are not in the first 10 or the worst 10, so to speak, but we believe that there's still so much that is happening because the statistics show that it's not up to 700,000 of the preterm birth that occur in Nigeria, they die per year. So that's actually a lot. Looking at where we are supposed to be.
Yeah, we haven't reached our goal at all.
Exactly.
It's MDG 4, and by 2015, which is just a few months away, we should have reduced the number of deaths by 3/4.
Yes.
Okay. So before we go to causes and all that, the World Health Organization says the numbers are rising. Why are the numbers rising? I mean, we've taken up this challenge. Let's reduce this. Let's stop it by 2015. But numbers are rising. Why?
Numbers are rising. A lot of factors actually will play there. Then, of course, that will still lead us to the risk factors for it. I would say awareness is really poor in our environment, and the socioeconomic status of our women low because that's a very great risk factor for preterm birth. So the numbers are rising. It's not, one is not to be surprised because of the awareness, as we say. And even in our practice, you see women that would perhaps come to register for antenatal, but that's when you see them last.
And they don't come again till they have a baby?
Yes, they will look at, they will tell you what they pay for antenatal is so much, relatively, and you won't see them again. The next you'll be hearing, if at all you ever see them, you will see them after they've gotten complication because they would have gone elsewhere, perhaps to the traditional birth attendants for delivering. And when there's complication, they now they rush them to where they started from. So this all goes down to low socioeconomic status.
So are we saying that these numbers are rising only in the developing world and not in the developed world?
I would say it's also the same, but one thing one should put in mind is that in the developed world, they always, because they have good statistics, there's always effort to curb it. But over here, our statistics are very poor.
So we don't even know what we are facing.
Exactly. Statistics are poor. You go to one state, you have something different from where you get elsewhere. And sorry to say, the facilities, our institutions, they are depreciating because even when you eventually get this preterm birth, how did they survive? Because majority of times you cannot actually find a cause for this preterm birth. But when they are born, they actually have the chances of survival. But because in our institution facilities are poor, so before you know it,
lots of them don't get to
exactly. And of course,
that brings us to causes. You've already mentioned that sometimes the cause is not known, but there are causes, known causes that bring about preterm birth. What are those?
They are numerous. However, as I said before, we consider the word risk factors because the actual cause in most of the cases, you may not actually just pinpoint it, but there are factors that will lead to it. Common one that we know, it's infection of the genital tract. Okay, when there's infection, that can lead to preterm labor, and of course, if it's not well managed, leads to preterm birth. Then another thing, it's the one that you can really pinpoint easily. Those that have abnormality in their cervix. Cervix, the integrity is not so good, so that just when the pregnancy is halfway, the weight of the baby starts causing a funneling, a widening of the lower part of the womb. So as a result of that, soon they burst their water, or they break their water, and labor ensues, and before you know it, there's delivery.
Well, isn't there a way to determine that a woman doesn't have a very competent cervix before she has that accident?
Generally, it's only when she's had previous occurrences that it can easily be traced, because a woman just comes to you and perhaps that's the first time she's getting pregnant. If she has what we call intrinsic weakness, perhaps from birth, what we call congenital, it's in that pregnancy you may start seeing it. But if a woman comes to you and she has told you that one or two pregnancies she's had before, she lost the baby at the middle of pregnancy, that creates us awareness. Even if she has not even gotten pregnant, we start watching and looking out for that. Then of course, with ultrasound scan, we can actually see it happening and can actually preclude it from happening eventually.
That's a more comforting thought. Exactly. At least there's an objective way of actually seeing it. You were mentioning causes. What are some of those other
causes? Yes, I've mentioned the low socioeconomic status, very, very important. Another thing is low pre-pregnancy weight of the woman. A weight less than 50 kilograms.
That's the mother now. Yes, is not of a good size.
Exactly. Okay. So it's a risk factor. Another risk factor is low age, 18 teenage. Then of course, age greater than 40 years. There are risk factors. When there is a short interval between pregnancies, usually we talked about less than 3 months, is a risk factor for a woman having preterm delivery. And of course, if she has multiple pregnancy, like twins, triplets, because generally the average age of delivering is shorter, so that's another risk factor.
Why? Is it because of the weight of the babies?
Certainly.
Okay.
So as the number of
become
babies,
too heavy for her to keep carrying them.
As the number of babies increase, the time where they are supposed to give their shortens. So that's another risk factor. They're numerous. Then I've mentioned the weakness. Then of course, women that smoke, they take drugs during pregnancy, they have that risk factor. Also, women that do not gain enough weight during pregnancy, because there's an average weight you expect for a pregnant woman to gain. Also, they are at risk of preterm labor. Women also that will not attend antenatal care, they don't receive the necessary care that obstetricians are supposed to give to them, they also are at risk of preterm
Is it
labor.
just the care when they go for antenatals, or is it important to attend some of these classes that they hold for pregnant women?
It's also important actually, because that prepares them, because when we talk of problems with pregnancy, mother and the baby, they are what we call delays. The first one is the woman does not even know there is a problem. So that's where the antenatal classes come in. The woman is informed. But remember I mentioned that many are unaware, lack of information. So those classes are important. However, even if you get those classes, you don't do what you're told, you will still not have the problem solved. So coming, because when they attend antenatal regularly, the problems can be found, detected early enough, and they manage, because there are other conditions that can lead to early birth, even though in those cases obstetrician will even have to do it, because if you prolong that pregnancy, baby is likely going to die, and it's going to affect the mother's health, like high blood pressure, diabetes in pregnancy. So those are conditions that can be detected early enough during antenatal care, so that if a woman is regular with that, you can detect and treat them so as to prevent the what we call iatrogenic premature delivery that the doctor will have to do, because he needed to save the mother or the baby's life.
Okay, can I bring this down to our everyday English? You discover that a woman is diabetic and it's likely to affect her child, or her blood pressure is rising. So what you do is you manage the blood pressure.
Exactly.
You manage the diabetes.
True.
So that the pregnancy can get to term.
Exactly.
That's what you're saying.
Exactly.
Okay. That means that antenatals are very crucial.
Very, very.
Very crucial.
Very,
okay,
very.
These are some of the things that moms and others need to understand.
Exactly.
Because a lot of people say antenatals, it's not up to 3 months. Why should I do that? It's too early. You know, they laugh at me. They actually believe people will laugh at them. And people do laugh. I've seen people laughing and saying, 8 weeks pregnant, what are you doing in the hospital? They don't need you there. Let the doctors see people who are really pregnant. But is that right? Should a woman start going for antenatal clinics as soon as she discovers she's pregnant? Or should she wait?
You see, the thing is, actually, we group patients depend on the risks they have. For somebody that is getting pregnant for the first time, I would advise her to come, because there and then you can actually find some conditions. However, for a normal pregnancy, a woman that's had normal previous pregnancy, generally you want her to register from the 3rd month.
Okay.
Okay, because
if everything is okay.
Yes, exactly. You understand? So, but not to jettison or discounting on somebody that wants to register early enough, because there and there, when we see if all is fine, we give the person a long appointment to come.
Okay, so you don't discourage a person saying, "What are you doing?"
No, because when they come early, you can actually ask for a scan. There's what we call ectopic pregnancy, which is getting early. It would just be in the wrong side, in the tube. So if the woman decides to say, well, let me just stay at home, and suddenly she comes bleeding, I know then, of course, she's lost it and her life is at risk. But if she comes early, you ask for an obstetric scan, you can detect where the pregnancy is. It's inside the uterus, you're happy, and you advise her to come 4 weeks after. So because of that, it's still very good for them to come.
In early. Yeah. We're going to have to take a break now. We're taking a break, short break. When we come back, you can call in with your questions. Stay with us.